To begin the subclavian technique, we will start by looking at the anatomy from the operator's perspective. Here is the suprasternal notch.
And outlined here is the clavicle. Here is the deltoid border, and running approximately here is the pectoralis major border. There are three specific landmarks for the subclavian line insertion. One is the lateral border of the pectoralis major muscle that makes the inferior border of the fossa. Two is the medial border of the anterior deltoid that makes the lateral border of the fossa. And three is the inferior border of the clavicle that makes the superior border of the fossa.
When looking at the clavicle, you can divide it into thirds. Here is roughly the center of the clavicle. You want to enter the needle at the lateral middle third of the clavicle, which is approximately 2/3 of the way to the shoulder.
You want to enter the needle into this depression. This is the fossa between the pectoralis major and the deltoid. To begin needle insertion, you want to aim the needle at a specific trajectory approximately 30 degrees caudad to the clavicle, pointing toward the suprasternal notch.
The puncture site is deep to the lateral part of the middle third of the clavicle.
Then, once the needle is inserted, you can use your thumb to gently press on the needle so it can sneak under the clavicle. Advance the needle with gentle aspiration pressure until you are in. If the operator decides to enter the needle a little more medially, they would have to aim the needle more cephalad at about approximately a 45-degree angle.